Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. In honor of Rory McIlroy's win at the Masters and winning the Golf Grand Slam, I'm in my golf attire. This is the second video I'm making in my golf attire. But today's video is actually really important, and honestly, I think it involves all of us. If we're all honest, we would all say, geez, like, it's harder for me to do things. Like I had a patient, and basically they put it this way. And the patient didn't even come in with like cognitive things or this or that, but we were just talking about when the jugular veins get compressed, the brain can't get rid of the toxins during the night. So what's supposed to happen when you go down and sleep at night, during certain phases of the sleep cycle, it's almost like a washing machine where whoosh, whoosh. And you and I know this occurs because all of us has had times where we just took a power nap, 5 minutes, 7 minutes, 10 minutes, and you're exhausted and you're only lay down, but you do fall asleep a little, and you wake up like in 10 minutes and you're like, I feel way better, like I feel fantastic. Well, what happened in the 10 minutes was your jugular veins opened up and it was like a washing machine, whoosh, whoosh, and the brain pollution, if it will, got out and the brain pressure went down and you felt a lot better. So in all of us that use cell phones, that use computers, right, that maybe don't have as good a posture as we should, brain dysfunction is basically happening to all of us. So I wanted to just go through some of the pathophysiology of brain dysfunction, and depending on what part of your brain is not working quite right, that will give you different symptoms. But note, if one of these applies to you, the treatment is you have got to open up your jugular veins. You have got to restore the integrity of the ligaments in your neck, and you have to try to get a normal lordotic curve. So the cervical curve is supposed to be deep and lordotic. Most of the curves that I see in the office they're reversed because people spend so much time looking down at a cell phone. So if we think of the areas of the brain, the occipital lobe is vision, parietal lobe is sensory information, the motor area is muscle movement. This is a very common area that's dysfunctional in many people. Like the frontal lobe it involves our personality, memory, higher executive function, problem solving, organization. The limbic area of the brain has to do with emotional things. The thalamus is sensory information. The hypothalamus and the pituitary gland. It's unbelievable how many people come into Caring Medical, the Hauser Neck Center, and they have water metabolism problems, dizziness, and they're fainting, and they feel unbelievably exhausted. And then when we test them, their blood volume is very low because hormones in the hypothalamus and the pituitary gland are not getting secreted, such as antidiuretic hormone. And another hormone that seems to be low in people is aldosterone, which has to do with salt metabolism. Then the brain stem is our relay areas of our body. And the brain stem is just above the atlas. In the brain stem is your peeing center, your pooping center, your gastrointestinal center, your breathing center, your autonomic nervous system center. So yes, you could have bladder problems or urination problems, and it's from ligamentous cervical instability because it screws up the micturition center in the brainstem. Yes, you could have all kinds of digestive problems, and it's from a brainstem problem. Your autonomic nervous system, yes, you could have dysautonomia and it be from a brainstem problem because the fluid is getting blocked right here, so there's increased pressure on the brainstem. If we look at 2022, so 931 patients come to Caring Medical or the Hauser Neck Center and look at the symptoms, right? Over half of them have lightheadedness, insomnia, blurry vision, depression, sensitivity to light, ringing in the ears, tinnitus, irritability, muscle spasms, dizziness. Over 60% have brain fog, problems sleeping, difficulty concentrating. Fatigue is number one, with neck pain, anxiety, headaches. And this is only a partial list. But it just shows you neck problems can cause all kinds of things. Flashing of light, eye pressure, blurry vision. So do you have a brain dysfunction? Is there something that's not working so good in your brain? Well, the most common thing that I hear is I got brain fog or I have brain fatigue. Brain fatigue or brain fog doesn't go away with extra sleeping. So it's like you could sleep and sleep and sleep, but you just get more and more and more tired. And that occurs because even when you're sleeping, your jugular veins aren't open, so the brain can't repair itself, right? Why do we sleep? We sleep so our memories get consolidated, meaning that the things that happen to you during the day, especially the things that are significant, they get wired into our brain during the night. So if you're somebody who doesn't sleep very good, right, then you start noticing, like, I'm forgetting things. Like, you don't have the ability to retrieve memories or make new memories, or at least it's compromised. The other thing that occurs during the night is the body's supposed to repair itself. So basically, the body goes through the process of detoxification, including the brain, at night. So again, if your neck structure is broken, you have cervical destruction. The jugular veins are getting blocked. The jugular veins are getting blocked. So the brain can't get rid of the waste products. The waste products just accumulate in your brain, and you could say it's akin to, imagine you have a lot of guests that continually come into your house, but the toilet won't drain, right? We've all been in porta-johns, we've all been at football games, and there's just SHIT, the here, there, and it smells to high heaven, right? So imagine your brain can't get rid of the waste products, or because of vagus nerve degeneration, you're just getting waste products all over the body because you have increased pulmonary or lung permeability, increased permeability in the lungs. You have increased permeability in the digestive tract. So all kinds of things are getting inside the body that shouldn't. So basically you get inflammatory substances, toxic inflammatory substances accumulate in your brain, in your body. You have achiness, fibromyalgia, you have all this sensitivity. You're exhausted, and all of this can occur because of a structural neck issue. So if you feel like you're getting dumber, it takes you harder and harder to do your work. You're more impatient. You've had personality changes. You're just not enjoying life anymore. You're feeling kind of depressed and anxious. You probably have brain dysfunction. In previous videos, I've shown this, but it's very important to understand that ligamentous cervical instability can cause dystonia, like the head wants to go in a certain direction. You get tension in your neck. If you have clicking, popping, grinding in your neck, or you always feel tension or muscle spasm or sensitivity in the back of your neck, it's probable that you have ligamentous cervical instability and the muscles are tightening to try to stabilize you. This can happen in the lower back too. If you have lower back stiffness that won't go away, or you lay down and it's better for a little bit, then you get back up and it occurs again, and you probably have ligamentous lumbar instability. Ligamentous cervical instability can cause imbalance, dizziness, It can cause all different kinds of headaches, migraine headaches, tension headache, pressure headaches, cluster headaches, all kinds of digestive problems, bloating. If the nerve supply is very compromised, the vagal nerve supply to the stomach, you get gastroparesis. You can get achalasia, where the vagus input to the esophagus is impaired. You can get dysautonomia or autonomic nervous system dysfunction causing mast cell activation, all kinds of allergies, asthma, food sensitivities, besides just neck pain and a host of other symptoms. So cervical lordotic curve with normal cerebral spinal fluid around brain, brainstem, spinal cord. So what's supposed to happen is if you have a good cervical curve, then fluid flow into the brain, out of the brain often is normal. It's usually normal. But once there's destructive changes in the neck structure changes, it starts impairing fluid flow into the brain and out of the brain. And it does this by blocking the jugular veins, which has to do with fluid flow out of the brain. 70 to 80% of the fluid inside the brain is in the venous sinuses, which drain into the jugular veins. Like the main drainage port from the brain to the body is the internal jugular veins. When the internal jugular veins are blocked, the cerebral spinal fluid can then go into the lymph system. So if you're somebody who has lymph nodes in your neck or swelling in your neck, like I'll have patients come in and say, my neck's swollen, and the doctors don't know the cause, it could simply be that the water flow out of your brain is getting inhibited here at the atlas. That's where it occurs, right at the atlas. Then the cerebral spinal fluid then gets picked up by the brain G lymphatic system, which goes into the cervical lymph nodes. So when you unblock the jugular vein by correcting the neck curve and stabilizing the neck, if there's ligament damage with prolotherapy, the lymph nodes subside and then the fluid flow is restored, brain pressure goes down, toxins go out of the brain, then the brain fog goes away. And this week I had a patient tell me, I had no idea that I wasn't sleeping. Like, it was a mother of 8, you'll see her video. But basically, we found out there was a certain position that she had to sleep in that maximized the jugular veins being open. And once she did that, right away it's like, oh my gosh, she had so much more energy. So much more energy. Now, I'm just going to go through pretty quickly the different parts of the brain and what, like the first slide is just about normal function, but the rest of them are going to be dysfunction. So if you think one of these applies to you, I'd ask you just to read all the stuff that we wrote. But basically, the relay systems that control what happens in the body is in the brainstem. And the problem is when you have brainstem dysfunction, for instance, there's a block of the CSF, or there's a block of fluid flow out of the brain because the IJVs are compressed, internal jugular veins, you get increased pressure on the brainstem. The increased pressure on the brainstem, because it affects the urination center, the autonomic nervous system center, the pooping center, the gastrointestinal center. So you can get anything from difficulty breathing to excessive urination, to difficulty swallowing, poor balance coordination, abnormal eye motions, all because of brainstem dysfunction. The occipital lobe has to do with vision. So if you have some visual distortions, you have odd visual symptoms, it could be that you have occipital lobe dysfunction just from IJV or cerebral spinal fluid being blocked because of destructive neck changes. Visual field defects are basically, I can see fine right in front of me, but maybe down here I can't. So again, going to an ophthalmologist is a good idea. Getting a brain MRI is a good idea. And if that doesn't work, then coming to a center like the Hauser Neck Center to see if there is a structural neck problem causing the vision issues is a good idea. Then the parietal lobe has to do with, it processes sensory information. It interprets like basically sensations in the body and in the environment. It gives proprioceptive or 3D perception. When you have increased pressure on the parietal lobe, your 3D perception is off. Like I know that's about 5 feet away. You know, all these things, you can understand like how that could get somebody dizzy and stuff. And they get incoordination. They're disorganized with writing, mathematic difficulties, and they basically have problem solving. The sensory area, there's a sensory area in the brain, and when that's affected, you have problems interpreting and responding to sensory information like somebody touching you, sound, sight, taste, hearing, and smell. Like I'll have people that say I got kaleidoscope vision, like they look and there's all these different colors, or all of a sudden you have a favorite food that's chocolate cake, even though you're not really supposed to eat a lot of chocolate cake, but I won't tell anybody. Like in other words, all of a sudden you start eating chocolate cake and it tastes terrible. Like all of a sudden it tastes terrible. Well, that can be from cervical disstructure, ligamentous cervical instability, and your ability to process sensory information. And again, sight, sound. So there's people that they'll hear sounds when sounds aren't there. Or there might be a car beeping, but you don't hear it as a car beeping. You could hear it as chirping. You know, like in other words, the perception of what it is incorrect. So if that's you, then think about getting your neck checked and see if you have internal jugular vein compression causing increased brain pressure on that part of the brain. So the motor area, that's what controls muscle movements. So if all of a sudden you, your parent, your child, all of a sudden you have a tremor, like an involuntary tremor, or you go to do something and all of a sudden your hand shakes, that can be from dysfunction of this part of the brain. Or if all of a sudden you got spasms, or there's some unexplained weakness, like your muscle tone is way down, that can be from motor area dysfunction. There's certain jobs, like if you're a violin player, right? Like there's all these fine movements that you do as a violin player. So if all of a sudden you notice, like you're clumsy, or you can't type and all of a sudden you're clumsy, you probably have motor area dysfunction from internal jugular vein compression or some other cause that's increasing the pressure on that area of the body. Now, it's relatively common at the Hauser Neck Center. Well, we'll have people come in when they've been told they have psychogenic seizures, right? Or they have functional seizures, where it's psychological. And the reason why the doctors call it psychological is the people seem kind of nutso. You know, like the person, like we've had several cases recently where the person will turn their head a certain way and all of a sudden they might be tremulous or they just stare off into space. You know, like they're kind of there and they're not there. Well, it's basically absence seizures or petit mal seizures. These are real things because of increased pressure on the temporal lobe. So with temporal lobe dysfunction, you can get the things that I just said, but you can also get poor memory, cognitive decline, word finding problems, difficulty problem solving, and then it causes like crazy emotions. If you have a calm kid or you're a calm person, all of a sudden you can't control your emotions, it might be that you have temporal lobe dysfunction from internal jugular vein compression. Brocas area has to do with speech. So if you're having terrible word finding or you can't get the words out, you know, like you're having really trouble speaking. Well, you could have, again, internal jugular vein compression, increased pressure on the Brocas area of the brain. Reading out loud and having conversations all of a sudden becomes difficult. Like you're stuttering and you just can't find the words. Wernickes area, also with speech production and comprehension impairment. And there's auditory. So in other words, when somebody says something to you, you have a hard time understanding it. And again, you can have those same things that Brocas has, where you just have a really, really difficult time holding a conversation. Like your comprehension of speech isn't good, but you could read something and it may be fine. So that again could be dysfunction of Wernickes area because of increased pressure from cervical structural problems. Now the main one, when I look at MRIs, typically where I see the fluid accumulation is in the frontal lobe. And I think this is ubiquitous. Anyone who has a structural neck problem affecting fluid flow, I would say the most sensitive indicator is going to be frontal lobe dysfunction. So frontal lobe dysfunction, when the frontal lobe, because it's involved in basically things that make us human, like what makes us human versus animals is, we can look at something and problem solve, and there's right and wrong, and we have higher cognitive function. All this stuff occurs through the frontal lobe, memories. So anything that you do that takes a skill to do it, being a mother, being a doctor, your occupation, think about all the things that you've learned in your life. It all goes through the frontal lobe. So imagine if all of a sudden your frontal lobe wasn't working, what would that cause? That might cause derealization, depersonalization. You don't even feel like yourself, like you're in somebody's body. Like you're a gregarious person, but all of a sudden you're very, very depressed. You don't want to do anything. You have apathy. You don't care about things. You don't care about others when you used to be a very caring person. These are all signs and symptoms of frontal lobe dysfunction. You have gaze instability. So what happens is when you're moving or you're watching something that's moving, the two eyes don't see exactly the same thing. So what's that going to cause? You're just going to be dizzy all the time, or you're going to have maldebarkman syndrome, which is where you feel like everything's rocking, like you're always on a boat. You have visual distortions. You see flashes of light. You might have visual snow, where the image isn't clear. There's sparks of light, or it's as if you're in a snowstorm. Problem-solving difficulty, impulsive behavior, trouble finding words, weakness, emotional immaturity, tangentiality. Well, people that know me well would say, yeah, man, I got that for sure. No, but basically I'll go from here to here to there to there. Then I'm like, what was I going to tell you in the first place? But the main thing is, if there's been a change, right? I've been that way my whole life. So the tangentiality of my speaking, and you guys probably know this too from watching some of the YouTube videos, it's like, man, Doc's going all over the place. But if you've had a change in your personality, and especially if all of a sudden you used to care about a lot of things and now you don't, you probably have some frontal lobe dysfunction. And eventually you get depression, you have difficulty holding a job, and you have poor insight and judgment. And if you talk to a lot of parents, their teenage kids and their kids in the 20s that are still at home, I think a lot of it's this, like they just have an apathy, right? You have a 16-year-old and they don't care about getting their license. Like they're just apathetic. They don't care about anything. I'm telling you, all the years and years of being addicted to the cell phone, looking down, they probably have frontal lobe dysfunction. So it's actually a structural issue. Now there can be a nutritional component and other things, but a lot of times it's a structural issue. So ligamentous cervical etiology of olfactory nerve dysfunction. I just put this on here because the cervical structural issues can block the jugular vein, block the cerebral spinal fluid, so it can affect all the nerves. So it can affect the smelling nerve, the hearing nerve, the balance nerve, the eye movement nerve, the trigeminal nerve, which has to do with sensation in your tongue, your mouth, your face, your eyeball. You have eyeball pain, you have tongue pain, you have mouth pain, you have weird kind of facial pains. It can all be from this mechanism. It can affect tongue motion. If you're having trouble with tongue motion or you're having difficulty controlling your tongue, if you've got stiffness in your neck or the muscles right here, the sternocleidomastoid or here, this process can affect cranial nerve 11 or the spinal accessory nerve. It can cause changes in taste, changes in smell, changes in what you see, changes in what you hear. And then basically, the kids got to go from here to here. The children have to go from here to here. The young adults and adults have to go from here to here. So all of us have to take responsibility and be looking up for really severe cases. Coming to a center like the Hauser Neck Center is a good idea. We can just figure out what is the structural neck issue, what to do about it. Sometimes when there's a lot of instability, to tighten the ligaments, we'll do a procedure called prolotherapy. Generally, prolotherapy is a series of sessions. We usually see people about once a month. And depending on the severity of the case, we'll determine how many sessions are needed. The first place to start is, instead of doing that, do that. If you look down, eventually you're going to get problems in your vagus nerve, jugular vein. If you look up, you'll restore the neck curve, and hopefully the vagus nerve and the jugular vein will function normally. On X-ray, this is what it looks like. So this is what a normal cervical curve looks like. Jugular vein and vagus nerve are fine. This is a patient of ours who has a reversal of the curve. So see the difference? This is a normal curve. That's a reversal of the curve. And the jugular vein and the vagus nerve get shellacked there. They get choked out. And you don't want your jugular vein and your vagus nerve getting choked out from a jiu-jitsu move because your atlas went forward. So the way to get your atlas back, so instead of looking down at a cell phone, right, to get the top vertebrae back, you got to look up. And then when you're sleeping, you got to look up. And basically, I'm going to leave you with this. Frontal lobe dysfunction, is it the reason we all seem to be dumber, more impulsive, less rational, truly struggling? Perhaps the problem is in our necks and not in our brains.